These are actual things that we see that people believe. And so we have to be aware of what's out there so that we can help them, if possibly give them the right information, those types of things. So let's see if I can do this. Okay, so here's the first one. Each person is born with a certain amount of sexual drive, which if you if you do too much of it in your youth, then you don't have enough of it. So there's only so much of it, and then you can wear it out. And that's why older people don't do this as much. I got to see how many people we got here so I know we're getting close. There's about 11 people that are either just turned their computer on or they're off doing something else. Because I only have 19 of you that's voted. Okay, well, let's go from on this one and see what everybody's saying. Okay, so the majority of you guys feel that it is false. I don't think anybody thought that this was true. And we know that there really isn't a certain amount that if you use up too much of it here, you can't use it up here. Okay, it's kind of gross. Anyway, so let's see. Oh, thanks, Jess. I didn't realize sometimes if you're on your phone, you can't participate. Well, let's go to another one of these wonderful, cute little questions. Let's have to push 5 million buttons to get it to work. Okay, so the need for expressing one's sexuality becomes less important later in life. I'd like to know what they consider later half of life. So does that mean at 50 it doesn't count anymore? If we're going on 100 years or something? Okay, that's pretty close. We got like 23, 24 of you guys. Okay, let's see what we've got here. So one says it's true, or feels it's true, or either pushed the wrong button, and the rest of you feel it's false. So I don't really think that there really is a way of, that becomes less important, or else the plastic surgeons wouldn't be involved, and they wouldn't be selling all the wrinkle cream and all those other kinds of things and trying to make yourself look good and still how you feel about yourself. So let's see what the next one is. Okay, sexual abstinence, that means not having sex, is necessary in training for sports. And I can tell I'm going to see how old you guys are, because this definitely was true when I was going through high school. Possibly one more. 1, 2, 3, 4. Okay, majority of them are in there. So it looks like one feels this is true, and the others feel that it is false. So actually, there is no evidence that says sexual abstinence is necessary in training for sports. And those of you who might be athletes probably know that. As actually, sexual intercourse, those kinds of things decrease stress and actually help in some ways. So there's a thing for you. Okay, excessive sexual activity can lead to mental illness. That's what my problem is, I think. See how that poll's going. If I can find it now. Come on. Oh, there I am. I got it. Okay. So we've got two saying this is true, and that maybe they have personal experience with being mentally ill. I don't really think it is so. Most of you guys figured that one out. Let's go to the next one. Wet dreams are an indicator of sexual disorder. Now, you have to know what a wet dream is. Let's see how many you got this one. Boy, you guys are really putting them in here fast on this one. Oh, Nikki. I think we picked up a few more people while we were doing this. Okay, let's see what we've got here. Okay, so what it's saying that all of you guys think this is false. Yes, you're correct. Wet dreams are actually a normal way of a male's body getting rid of excess sperm and seminal fluid that it doesn't need. So if it doesn't use it, it just gets rid of it. Okay? And usually, if you have someone who's a sexually active person who's getting rid of it periodically and on a regular basis, they don't, a lot of times won't have wet dreams because they don't need one. Okay, let's see what we have on the next one. Orgasm should be explosive, mind-blowing, and earth-shattering. And we will start our poll. It's too bad we can't have this so it's male and female. It'd be interesting to see, you know, if you're a guy or a girl, what you feel. Okay, we're up to 25, 26, 27. Okay. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So 8 of you feel that this should be true. Well, that's what the movies are telling us. Okay, right? And everything you read in all the magazines, there's something wrong with you if you don't have this. Then about 20 of you are saying, so 2/3 of the class are saying false. And as much as I'd like to say it's true, it probably in essence is more on the false side. Okay? It is not always mind-blowing and it doesn't mean that there's something wrong with you. Okay? The ability to achieve an orgasm is an indicator of a person's sexual responsiveness. So if you're super sexually responsive, you will have those mind-blowing things. Okay, we're up to 26 of ya. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Let's publish them. Okay, so we've got mixed feelings on this one. Feeling that achieving an orgasm is an indicator of person's sexual responsiveness. And false, the majority are saying false. So sometimes you're going on your perceptions of what's going on. Again, just because one is better than another one doesn't mean that there's something wrong. But there can be people who are distracted and not into it or whatever. Okay, face-to-face coital position is the proper, moral, and healthy position. That is the missionary position, face-to-face. Let me see. I got to get it there. There goes the poll. Everybody's busily trying to push that in there. I'm going to stand up so you can see my name tag. One, 2, 3, 4, 5, 6, 7, 8, 9, 10, and publish. Okay, just because one person feels more comfortable with this position does not make this statement, that person wrong. I don't think there's really a right and a wrong. Some people feel more comfortable, but it just also means that there's other positions that you can do. You don't always have to be face to face. And there's certain times that another position may work better. Someone who is like 8 months pregnant, it's doing the face-to-face thing is really difficult because there's a huge thing between you. So there's just realize that is not the only way. And whether you feel more comfortable in that way or not, that's up to you, but you can't impose it on someone else. Okay? A larger penis has a greater possibility of producing an orgasm in a woman. Oh, go for it. Okay, let's see what we've got here. Looks like 8 are saying true and 22 are saying false. And I think it's also on preference. And you've heard the thing about it's not the size, it's the motion. Motion in the ocean? So just because you have a smaller penis does not mean that you cannot have an orgasm or a woman cannot have an orgasm. Okay. Oh, right, Kim. Okay, let's see what the next one is. Is everybody asleep already? Having intercourse during menstruation is dangerous and unhealthy. Well, I will tell you, it says you're not supposed to do that in the Bible. somewhere, I don't know where. Yay, looks like we're pretty close here. Okay, we got one true person and 27 false people. So it really, other than being maybe a little messy, it really is not dangerous or unhealthy. And a lot of people think that, hey, if I have sex during my period, I can't get pregnant. Unfortunately, that's a myth, and it can happen. It's rare, but it can happen. Just so you're aware of that one. A, in mature sexual relationships, both partners will achieve simultaneous orgasms. Okay, let's see what we've got here. So the majority feel that's false, either on personal experience or understanding how that works. And that's true. The whole fun part about this whole thing is trying to get them to work. And I'll show you in a one of my slides that shows you why sometimes that is really difficult to do. Okay, let's see what the next one says. It's unnatural for a woman to have a stronger desire for sex as a man. I'm from a whole different generation than you guys, and that was extremely true, or passed off as true when I was growing up. That you were some kind of a nymphomaniac or something, if you were even interested in that. And that's a Victorian throwback. Okay, let's see. So the majority feel that's false, and I really think it probably is, because, you know, we have, and when we're getting to what makes a person sexual and everything else, you have what you have is what, you know, this is the way a woman's supposed to be, and this is the way a man is supposed to be. And we're getting more and more where, why does that, why? Everybody's saying, why? Why do you have to be this way to be this and this way to be that? Okay, there's a difference between vaginal orgasm and clitoral orgasm. And this is interesting. This one's always comes out interesting. Almost there. Okay, let me see what we've got names on here. Oh, fake news. Okay, let's see what we've got here. There's a difference between, and again, supposedly there is not. But people have their own opinions about how things are and when they are and when they aren't. Okay, so either way works for me. In either way you answered, not either way. Okay, we'll go back. Take that back. Okay, let's look at this one. Women who have multiple orgasms or who really come to climax are nymphomaniacs or promiscuous. I'm not supposed to be able to do this. Okay, we're up to 27. Let's see. Let's get our results. We got one who feels this is true and one who feels this, most of you guys feel this is false. And actually, when we start talking about how women's responsiveness acts, you'll see how this is just multiple orgasms happen in women. Okay, it's not unusual. It doesn't happen all the time, but I'm just saying, just because they have them does not make them nymphomaniacs. Okay. Because of the anatomic nature of the sex organs, women are passive and men are aggressive. At least that's what our culture is supposed to be. There's places all over the world that I think enough people decided to put their thing in there. So we got 3 that feel this is true and 22 that feels this is false. And one of the things is that there really isn't some kind of anatomical thing that makes somebody passive or somebody aggressive. Women have testosterone too, so do men. Those kinds of different hormones. I think a lot of this and how you view yourself or how you view shit should be is more of a cultural thing or something that has been taught to you in a lot of ways. Okay. Men want sex more than women. That's what Cosmopolitan says. It says that they think about it more and they want it more. Okay, we're up to 27 of you guys. Let's see. Okay, it looks like 6 of you feel that this is true and 22 feel that this is not true. There are, I think it could go either way. And from things that I hear and stuff like that, depends on what your partner's like. And if you guys gel and are about the same, then there's usually not a problem. If one wants it more than the other, and comes and goes. So let's see what the next one is. Women are choosier than men. Okay. We've got 10 saying true and 17 saying false. And actually, depending on your age, they say that actually women are more choosy than men. Okay, there's a lot more consequences to for women in a lot of ways, especially before we have birth control and things like that. Okay, let's see what we got on the next one. Women think about sex as often as men. Okay, you're going to tell the story on yourselves. Okay. So it looks like the true one out of this group and 10 is false. And again, women probably think about sex as much as men do. They just aren't as verbal. And it's okay to think about it. I don't know, Mark. Why would somebody who's married think less about it than somebody who's single? It just depends on your situation. Okay. I think we have one left. Hey, men are more promiscuous than women. I think society has told us that men are supposed to think about it all the time, and women aren't. So it depends on if you really agree with it. Okay, we've got 10 saying true, 18 saying false. On this thing, it depends on the age of the person, but usually younger men are more promiscuous than women just because the consequences are different. They're just the depositors, and if things go wrong with a woman, she ends up with a baby or something like that. So there's different consequences to the whole thing. But let's talk a little bit about what sex is, okay? And it might give you a little bit better idea. So if you look at sex, the term actually denotes chromosomal sexuality. So if you're an XY, you're supposed to be a male, and if you're an XX, you're supposed to be a female. But as we look at it, it's a lot different than that. There's a lot more that plays into this whole thing. So let me just go through. I am a very visual person, so I have to look at exactly what are we talking, parts are we talking about. So we've got, you've got in a male and the genitalia, you're looking at the scrotum, you're looking at the sperm, you're looking at the prostate, you're looking at the penis, the head of the penis, all those areas there. You also, if you keep going around, you also have the anus and everything else, depending on what is going on. So that's what a male looks like. And in the female, the genitalia is you've got a lot of kinds. You've got the uterus itself, you've got the vagina, you've got the gluteal folds, or the labial folds, and you've got the clitoris and the things that are happening there. So let's go on to talk a little bit about the components that make up human sexuality, or identifying and human identity and sexuality and the well-being. So the degree to which a person exhibits and expresses maleness or femaleness all depends on different things. It depends on your physical look, your emotional feelings, and your mental. So there's three things going on there. And it's defined by, a lot of times, by your genitalia, by the hormones that are running through you, your attitudes and your feelings, which take precedence. There is a part in there, okay, about that. These, a lot of times, are learned behaviors and how a person is supposed to react in his own and her own sexuality. This is what a male does. This is what a female does. So what happens when we have conflicts and attitudes and feelings that maybe conflict with that, or maybe the hormones are off, those kinds of things. And it's an integral part of a person's identity, and it will present in different ways in how we act, how we communicate, and our physical actual appearance. So if we look at sexual identity, and the next one, it encompasses a person's self-identity, their biological sex, their gender identity, okay, their gender role behavior, and their orientation. So it gets really complicated. So the gender identity is actually the inner sense a person has for being, whether they feel male or female. Now, gender role behavior is a behavior of a person who conveys about being male or female and how they're supposed to act. And then your sexual orientation is your preferred gender. Sometimes we can have conflicts in these, and we see that all the time. Nice to meet you. Let's talk a little bit about some terms. So if we look at what heterosexual sexuality is, it's one who experiences sexual fulfillment with a person of the opposite gender. So a male with a female with a male. Homosexual is one who experiences sexual fulfillment with the person of the same gender. So you've got a male or female. Bisexual is that they actually get sexual fulfillment out of both heterosexual and homosexual relationships. And then transsexual is a person who, of a biological gender, who has the feelings that they shouldn't be. Say that you're physically a woman, but you feel more like a man. Okay, a transvestite and is one who dresses opposite from what their gender is. Now realize too that within this transvestite, not all transvestites are homosexuals. Okay, a lot of times they call them gender nonconformists. There are people out there that may be heterosexuals, but the women feel more comfortable in the male clothing, and the males feel more comfortable in the female clothing. That does not make them homosexuals. Okay, so just be aware that there are people out there who are heterosexual who are more gender nonconformist. I'm sorry, I have to stand up because my back hurts. Okay, the origin of sexual orientations are unknown. Some studies claim genetics, others culture and environment. I think it's a combination of all these things that are going on. Nice to meet you. So listen, if you saw this walking down the street today, what would you think? Actually, let me do this. In this fellow's day and age, men wore actually more makeup than women. And it was not unusual to wear tights and to be all glammed up and to have fancy stuff and everything else. So, but if we saw this at this day and age, all of a sudden they would just feel like, oh, yeah, this person's a homosexual because he isn't dressed the way you're supposed to be dressed. Okay, let's talk a little bit about some sexual acts and how that works. Yeah, those are nice tights on that guy, aren't they? Okay, so, ooh, they even have little tight bands. There's some nice looking legs. Okay, so sexual fulfillment can include touch, smell, sight, sounds, feelings, thoughts, fantasy, all those things. Okay? So explain to me a non binary. I don't really know. Hey guys, um, I gotta get up and move around for a minute. So I'm gonna give you a 10-minute break for just a second. Okay? Thank Okay, I've returned. Is everybody ready again? Okay. So I already went through and talked about sexual fulfillment, and those are some of the ways right here. Uh, and then sexual stimulation includes kissing, hugging, stroking, squeezing, breast stimulation, manual stimulation of the genitals, oral genital stimulation, anal stimulation, all those things. There's probably some other things that aren't written on the list. Okay. So let's look at sexual expression in itself. So sexual intercourse is actually the act of intercourse is the insertion of the penis into the partner's vagina, anus, or mouth. Okay, so those teenagers who think that sex is only insertion of the penis into the vagina need to be educated. So vaginal intercourse is the act of placing that penis into the vagina, and it can be accomplished in many different positions. Anal intercourse is the act of inserting the penis into the anus, the rectum of the partner. And the main thing with that is that because of the bacteria and things that can be in the anus itself, that it really shouldn't be reinserted back into the vagina unless it's cleaned off. Okay. Just so that you don't get infections up into the reproductive organs. So also, toad. I have little things that keep popping up on my thing. Oral genital stimulation is stimulation of the genitals by the mouth, the tongue. It might be used during foreplay or a way of obtaining an orgasm. Abstinence is not having sex. Okay. Masturbation is self-stimulation. So some other little terms. Now, the way that you're going to test it on these is they're going to explain, or they're going to give you a scenario of what somebody does or whatever, and then you're going to have to name what it is. Or they're going to say, hey, this person's a voyeur. So how would they achieve sexual expression? Okay, those kinds of things. So voyeurism is the achievement of sexual arousal by looking at the body of another. That's why you have all your the internet and the Playboy magazines and all those kinds of things. Are things like even going to a strip show, or, my mind goes to Thunder Down Under, where you go see the guys dance. Sadism is gaining sexual pleasure while you're inflicting abuse on another person. And masochism is gaining sexual pleasure from the humiliation of being abused. Now, if you combine those two, at sadomasochist, and those are people who they like both parts. Okay, they like to hit people and cause the abuse, and they also like to get the abuse. A pedophile is an adult who gains sexual pleasure by performing sexual acts with a child. Okay. So let's look at what the sexual response thing, when I was telling you about what things you will need to know what each of these are. Okay. Because they'll tell you this is this happens after that, that kind of thing. So we're into identifying the sexual response cycle and what usually happens in a human being. So we usually have a desire that begins, the excitement goes on, the plateau, the orgasm, and then the resolution. But I'm going to get into more detail as to how this works. So excitement, once you have the desire, the excitement is common in both men and women. You can even take a heat sensor and you can pick up things that are changing in their bodies with this excitement. You have an increased heart rate and blood pressure and pink flushing of the skin. A lot of times this happens. And plateau is greater than excitement, but not enough to begin orgasm. It's just very enjoyable. It looks like she's enjoying herself. Right there. Okay, and if we take it further, Then we get into, and of course I had to put that picture in there for everyone who really would wish that orgasms were like this every single time. So climax and sexual explosion, release of the tension has been building up over the preceding phase. Okay, that's what an orgasm is. Then there's a resolution. It's just kind of like, yes, you just, everything came to a climax and your energy's all gone, and there's a feeling of relaxation, fatigue, and fulfillment. Now, let me tell you a little bit about the difference in men and women. Okay? In men, they have an actual refractory period. It's a period in which they can, only males, it doesn't happen with women, is incapable of sexual response. Okay? This period of time is very individual. It can be a few minutes to even days. Depends on how old you are, the circumstances, everything else. So it's a normal, natural thing. So going from one to one to one to one to one to one, another, may not always be possible. That doesn't mean you're broken, okay? Because there's a normal, natural refractory period where males have a hard time being aroused. Okay, so let me show you what a normal cycle for a guy is, and then I'll show you what it is for a woman. So usually you have the desire in a male, and it will go up and it will plateau, and it will get more and more and more, and then they'll orgasm, and then they'll go down and have the resolution of a refractory period, and then they can start over again. Okay, so there is a small period of time here that it won't work, and you've got to let it reboot or get the energy back. Okay, so that is a typical way a man looks, okay, a male looks. Now I'm going to show you what a typical female looks like, and then you can see from all those questions that we were talking about where maybe it's a little more difficult to get these two together. Okay, so here you have the males. This is a female under here, guys. So on women, what happens is that you have the desire down here, and yes, it can go plateau, and then it can be fine, and then you can have an orgasm, and then it will go back down. So there's an A possibility. Then there's a lot of women will have where they may not ever get to the orgasm. They will go up and just be in that excitement plateau, that arousal, and it will go and go and go and go and then die. Okay? And then you also have, besides just one orgasm, you can have women who go in and you one orgasm and then again, and then again, and then the resolution. So try to put this one together with this one, and you can see why it isn't always possible. It doesn't matter how long you've been with a person or not, that this is always going to jive with that one. Realize, too, with both men and women, that the brain, rather than the genitals, play the most significant role in how people perceive themselves as sexual. Okay? Did everybody go to sleep? Okay, good. Okay, so let's talk a little bit more about some of these other things and some of the factors that are going to influence the whole thing. Okay, so we know that there's lots of factors and stuff that makes it so that won't work just as good as that, and then maybe this isn't going to be the best time, that is going to be the better time, all those kinds of things. So one of the first things you have to have is it has to be the developmental level that person is at. So the process of human development will affect your psychosocial, your emotional, your biological aspects of life. All those things that you're bringing into a relationship. Sexuality is the only distinguishing trait present at conception. From birth onward, gender, sex, influences, behavior. There's all those things that come into play. Okay? So every culture has its own norms regarding sexual identity and behavior, what you're supposed to do, what you're not supposed to do. I still remember watching a show of, and I don't know if this is true anymore, a woman had married someone from Middle Eastern country and moved there with him. And she was used to taking a shower every single morning. That was her routine, okay? That was her custom. And the other people in the household thought it was really funny, and they would giggle and laugh about it because a lot of times the only time you would take a shower would be after having sex. And so therefore they thought that they were just must have been doing it multiple times a day. So in some cultures, a woman might be expected to tolerate sex, and in others, her participation is encouraged. It all depends on what's going on and what situation she's in, and we are not all the same. And because our communities are so transient in a lot of things, just because you stay in one place doesn't mean that you're not going to see other people with other kinds of cultural beliefs and feelings. So all these are different pictures of different kinds of like weddings or mating rituals or whatever. And it'd be interesting things like when you have in the Jewish culture where you have the thing where you put them both on the chairs and you go around. Other cultures where you can't see the woman at all. The other ones where you have special jewelry and accoutrements that you have to have. We can find lots of different things that the people in this culture probably don't understand about this, or vice versa, and those kinds of things. So you're going to see people in different areas. And so culture is a big thing that actually influences how we view ourselves sexually. The other thing that influences is our religion. And everybody isn't Caucasian Catholics, or Christians, or so you have all the different religious beliefs that come into play. What should happen, and even within those different cultures, if you have the Jewish culture, there are several different sects and different avenues or umbrellas that are underneath that are different from each other, even though they may all be Jewish or Arabic or Hindus, different kinds of things, that they have different ways in which they do things. So the number of sexual dysfunctions can be related to an individual's guilt and anxiety. And they find that, especially with organized religion and how religion has said, this is the way you're supposed to be, this is the way you're supposed to act, what has happened is that it has caused a lot of mental distress when they start thinking that I'm not thinking the way I'm supposed to, there's something wrong with me. Those kinds of things. And that's when we come into play, when we start seeing where they have guilt about something or anxiety about something, or you have people think about, I've heard this from people, and now you say, now you're not supposed to have any kind of sexual activity before you're married, and that happens a lot in a lot of different religions. And so no, don't touch, don't look, don't think, don't even anticipate. And then all of a sudden somebody says something over you, and they'll go for it. And these people have to switch. It's like a 100 or a 360 degree turn. So many religions are re-examining their teachings on sexuality in response to the challenges posed by their members. So many of them recognizing the importance of sex education and also within the realm of the church. So those are kinds of things that they have. New interests in spirituality and marriage and supporting the intimacy. So again, religion has a big play in it. Now, ethics also does. Human sexuality depends on the freedom from guilt and anxiety. What one person believes is wrong might be perfectly natural and correct for another. Again, that's why we have to know what are we coming into the picture with as the nurse. You know, sexual expression is performed by consenting adults. It's not harmful to them. When practiced in privacy, it's not considered a deviant behavior. So, I mean, you can go on, if you're looking at ethics, these are some of the things that are thrown out there. Individuals shall personally decide which aspects of sexual expression they are comfortable with. You know, there are certain things that I would not be so comfortable with, but somebody else may. Frequently, all an individual needs is permission from a healthcare professional to alleviate the guilt and enhance their sexual satisfaction. So there are people who actually specialize in this and help them with their problems. So one of the other things, and you probably have seen how this is working, is our lifestyle. So modern lifestyle greatly affects sexuality and expression. So what we're doing, how much we're working, where time restraints, energy levels, motivation, going to school, doing that, working all day long. And then we threw in the pandemic and all these other things that are going on with our lifespan, our lifestyles. And what's happening is it's crucial to a relationship survival that we a lot of times take a step back and look at our relationship with that person. So whether it's intimate time or just quiet contact, we are a very social person. That's why this whole pandemic is being a mess, is because we like to interact, not all the time having sex, but I'm just saying we like to be with each other. We like to do things. We like to socialize. And when all of a sudden we're saying, no, you can't have that anymore, it's very stressful and it's causing some issues. And that's why you see more of your abuse factors are going on, and domestic quarreling and everything else because of the circumstances that our lifestyle now has placed us in. Now, some of the other things that actually will put or cause problems or have things is the health status of the person. Okay, so healthy body, mind, emotions are necessary for sexual wellness. Almost all hormonal disorders affect sexuality in some way. Okay, PMS is not a fun thing to have. Hormonal changes, all those kinds of, I think most the women can reflect, understand that. I mean, it definitely changes. Men have seen that in women too. Sometimes you're not as responsive, all those kinds of things, different hormones that are going on. Some of the other things too is when we start playing around with our bodies and how our bodies are supposed to be healthy and balanced. So when we end up with like diabetes, we see more erectile dysfunctions or impotence in men. It's not uncommon to lose the capability of an orgasm very muchly in someone who has diabetes. In women, difficulty in being aroused and a loss of lubrication, as well as frequent actual vaginal infections like from yeast and things like that. So seriously, if you've talked about STDs and everything else, if you have a whole bunch of sores down there, do you really want somebody close to you and next to you? Same kind of a thing. Things don't work as well when your body doesn't work as well. The other thing that we always hear a lot about are cardiovascular issues. So myocardial infarctions, anxiety over the effects. A lot of people will have like a heart attack or have issues that have to have heart surgery or something like that, and they don't want to put more stress on themselves. But then sexuality is a part of their life and their relationship with whoever. And so there's a lot of conflict and anxiety about that. So anyone who's going in and having, has had an MI may have those thoughts and feelings. And that may be something that you need to actually go ahead and look at when you're taking care of someone and see how they feel about what's going on. Stressors like overexertion, alcohol consumption, emotional upheavals should be avoided. We know that the body changes during sex, and the blood pressure goes up, things flush, things get more heated, and is it going to put too big of a strain on the heart? And a lot of times they will have you do a rehab kind of a thing where it isn't immediately, depending on what kind of procedure you had, where you will gently get back into it so you don't put extra stress on your heart and end up being like one of the Golden Girls who kept killing her husbands off. Hypertension, medications used to treat frequently causes change in sexual function. One of the things about hypertension is that hypertension makes everything kind of relax. Well, in order for men to have an actual erection, it has to flood with the blood and everything else. And if it's too relaxed, it's not going to do that. So a lot of your blood pressure medications, which are trying to treat the hypertension, also will cause erectile dysfunctions. And so it's very important that if you have a fellow that comes in and he's getting a new blood pressure medication or putting on blood pressure medication, that they're aware that that could be a side effect, and that and you can bring up the subject is, how is that going? Because there's other things that we can use that will work. Okay. Some of the other things that are big in causing performance issues are when we get into different kinds of medications, especially some of your antidepressants will do the same thing. We're going to talk about that in just a minute. Diseases in the joints and mobility. If you can't jump around the bed and do all those things like you did when you were 20, so you have older people that have knee issues and back issues and those kinds of things. And oh no, not that way. Yeah. So pain, fatigue, stiffness, loss of range of motion that comes with the disease of the joints affects both young and old. So they can cause discomfort, anxiety, even through the disorders themselves. That don't really affect. Your bad knee doesn't really affect how you perform, other than if you get in the wrong position, you're going to hurt yourself. Okay, has nothing to do with the sex itself, in essence, but it can interfere with it. Okay, same kind of thing as surgeries, how you pertain to yourself. If you have something that's removed, as someone who if you have a colostomy, how do you feel if you're single and you have a colostomy, or even if you're married? How is my partner going to react to this orifice on my abdomen now? Does he even want to get close to me, or does she even want to get close to me? Those kinds of things. What are their fears? People who have mastectomies because they've had breast cancer or something else, or because they've been distorted in some way because they've had to take something out. When I worked with a lot of the polygamists, they would do everything in their power not to have a hysterectomy. They didn't care if they were 50 or 60 years old, because that part of their body represented that they were female, and it would take something away from them if they did not have that. So you've got to look at those in everyone and what's happening and see if there's something that you can do to help them. Then we have other things that can cause major issues. You've got to have a body that's functioning. Okay, there's the joints, there's the surgery. If you have a spinal cord injury, how are things going to work? Okay, so individuals with spinal cord injuries, if you think where your genitalia is, and go back to the pictures that we had, they're at the bottom of the spinal cord. If you have problems all the way through, and the responses aren't getting all the way down there, how are they going to do and perform the way they're supposed to? That kind of a thing. Are you going to be a sexual person anymore if you all you can do is lie there and you really can't feel anything? A lot of times with quads and with paraplegics, there is a sparing, and a lot of times in the genitalia area, there's it's not. They have some feeling. Okay, that isn't always true with everyone. It's actually easier for a quad to, which is somebody with a high spinal cord injury, to father a child than a paraplegic, just because of how much lower the innervation is coming on the paraplegic, and where the actual break or damage is. The problem is that you have somewhere in a male, you have to have an erection and you have to be able to ejaculate. And those are two different things. And if they don't happen, you can't really take them out. You can't really take sperm out of the testes, because through when we were doing fetal growth and development and how sperm develop and everything else, that they're not totally mature. They have to go through all those different places to get and to be potent and to be what they need to be. Okay, so there's sometimes a lot of issues, a lot of times too, because your majority of your spinal cord injuries are actually males, that now the female, she may have to be the person who is taking the more aggressive and dominant role, and that may go against her culture, against her upbringing, all those kinds of things. So a lot of times you've got to look at, what does this mean to this couple and everything else. Chronic pain, just hurting all the time. If you're hurting all the time, you really, seriously, do you really want to get into it? Oh, no, I can't do that way. I can't do this way. So it interferes with your being able to concentrate, being able to feel desirable, and then you start having all those emotional feelings that come into it, and you just get somebody else. I'm not worth it here. So also mental illness, when your brain's not working correctly. Mind plays a very powerful role. We already had that film that shot up there. Even mild depression can affect desire and sexual functioning. Memory loss, dementia, forgetting about partners and relationships. I mean, you can turn on the TV and watch that Message in a Bottle, right? And he'd sit there every day and read her their story, and she thought it was just a story, and had no idea that was actually her husband and the love of her life. Those kinds of things. And again, the other thing where you're looking at that greatly influences it is medications. So these are just a few that can actually cause some dysfunction. So nitrates, anticonvulsants, antidepressants, antihistamines, hypertensives. These are the two biggest ones right here that we see most people. Your antidepressants and your antihypertensives. So be aware, because there's a lot of people on those that it can interfere with their sexual abilities. Antispasmodics, barbiturates, narcotics. And as much as people think, oh, I want to feel at ease and everything else, alcohol, cocaine, marijuana, they all have different effects on your sexual ability. It doesn't always enhance, and a lot of times they do the opposite. Okay. On to my fun last little picture. Let me see what that is. I think of what that is. Yeah, you can. So now let's talk a little bit about sexual dysfunction. Now we can see all the things that can play into it and all the things that can have the problem. So let's first go, this is a state in which an individual experiences or is at risk for, okay? changes in sexual function that is viewed as unsatisfactory, unrewarding, or inadequate. It all depends on your age and everything else and what's going on with you. So let's look at the common sexual dysfunctions in men. Okay, you've heard a lot about erectile dysfunctions, and they just have to figure out something to make money, right? So there's different things, and erectile dysfunctions are an inability of man to attain or maintain an erection to such an extent that he can't have satisfactory intercourse. Okay, now again, the places that we see, my back's starting to hurt. The places that we see that we have issues is that the causatives are usually psychological in this. And there are some physiological things that happen and some psychological factors. So we see this in individuals with a history of diabetes. We see spinal cord injuries. We see cardiovascular disease because of the types of medications that we are using. Surgical procedures, alcoholism. Think about all those things that I threw out at you. Antihypertensives, antidepressants, illicit drugs. All of those are stand right out and can cause erectile dysfunction. So there is enough of that out there that we know that that's something, and that there's whole entire clinics that go ahead and only work on this. Okay, so the next type that we see in men is premature ejaculation. So it's what that actually is reaches an ejaculation or orgasm before or soon after ending the vagina. So a very quick and very fast. It is not coordinated with their partner at all. A lot of times it's short-lived. So the cause is rarely physical, and usually it's usually a mental thing that's going on. So what I have to do is find out what the causative factor is and treat that. So what the patient defines as a dysfunction and his ability to control ejaculation. There's a lot of anxiety, there's a lot of guilt, lack of time, new partner. These are things that we see. Okay, so then you work with them on what's going on. And now a retarded ejaculation is ejaculation that's incompetent. It refers to men's inability to ejaculate into the vagina, or delayed intervaginal ejaculation. It just doesn't, he can obtain an erection, but he can never ejaculate. He can't get it out. Okay, so when it occurs after the man experiences normal ejaculation, the cause is usually some kind of interpersonal problem. And again, you've got to look at the causative factor. A lot of times we see this with neurological disorders. So a lot of your spinal cord injuries, they may be able to obtain an erection, but they cannot ejaculate. Okay, Parkinson's disease, we see that in men who have Parkinson's disease, and we see it with some of the medications that men may be on. Okay, so I am an equal opportunity person, and so let's talk about some dysfunction in women and what happens with this. So one of our biggest things that we see in women, let me just back up a little bit. Okay, you see those big billboards around, say, talking about Peyronie's disease. Peyronie's disease is actually a fairly, it's not super common, okay? What it actually is where men can actually, if they were too vigorous or something, could cause some forming of scar tissue on one side or the other of the penis, and it causes it to turn different. Now, realize too that men, if you were to look at a whole bunch of penises, okay, they aren't all straight, okay? They have, a lot of times will have a natural kind of a turn to them. But if it's an exaggerated and almost forced and looks like scar tissue and things, that may be Peyronie's. Okay, so let's look at inhibited sexual desire. And this is in women that we have inhibition of sexual arousal resulting in decreased congestion. We know that that women, because it's not all in your genitalia, it's in your head and everything else, that you got to look at the cause. So if you have a lot of anxiety, negative emotions, fear, interpersonal problems, physical problems, those kinds of things can interrupt in getting into this state of being sexually aroused. So a lot of times we will see it with hormonal oral contraceptives and hormones. Alcohol can do the same thing, and then also certain medications, which one of them can be antidepressants. Okay, a lot of times if you get dwelling into it, they may have a history of being sexually abused, rape, incest, depression, other sexual kinds of dysfunctions, and it inhibits them from actually letting go and getting into the whole entire environment. Okay, so organic or orgasmic dysfunction is the inability of a woman to reach orgasm. Now, that does not mean that a woman has to have an orgasm every single time. That is not true. It may not happen, okay? And they actually have found studies that the first time a woman has intercourse, it's very unlikely that they will have an orgasm. So anybody who gets one is happy there. Okay, so you got to treat the cause. The cause is similar to those of the inhibited sexual drive. Okay, and you need to look at their knowledge base. You need to look at how they communicate and their sexual patterns and what they do. Okay. Another one that we see a lot, especially in our older population, is a dyspareunia. That's painful intercourse. One of the reasons why we see it in our older people, our older women, is because of lack of estrogen. Estrogen causes lubrication and actually helps with all the things that are going on. And so therefore it's a little more dry. Vaginas and everything else are a little more fragile. And so being super involved might be painful. So we need to treat the cause. There's lots of things out there that we can do for women. And also, too, be aware that there are some men that can also complain of pain during intercourse. So fear and anxiety can also cause the pain, that they're afraid that it's going to hurt and things like that. We see it more in diabetics, people with hormonal imbalances. That's therefore you're seeing postmenopausal women. Vaginal infections, endometriosis, urethritis, cervicitis, rectal lesions. I mean, if you had any of those on there, do you really want somebody next to you or by you or very, very close to you? And the fear that you're going to have some issues. Now, one of the things that we see too is very rare. It's called vaginismus. Let me say that again. Vaginismus. Okay, it's a rare condition in which the vaginal opening closes very tight and prevents penile penetration. We see this more with our women who have not had any kind of sexual intercourse or it's been a very long time. So again, we have to treat the cause, whether it's physical or psychological. It's due to involuntary spasmic contractions of the muscles at and around the vaginal opening. And so we need to assess their knowledge of anatomy, sexual response, and we need to look at things like sexual abuse. Have they had trauma there? Have they been raped? Those kinds of things may come up when we are dealing with somebody who has been sexually abused. Okay. Okay, so the next one is vulvodynia. And now the vulva, if we go back to the picture that we had, is all those areas there in the genitalia of a woman. Chronic vulvar discomfort or pain characterized by burning, stinging, irritation, rawness, female genitalia that interferes with sexual activity. I mean, if those things are on fire, you really want anybody or anything touching it. So cause is usually unknown, and they usually will go ahead and use things to treat the symptoms so that it does not hurt and those kinds of things. Okay, finishing up on our stuff. We're getting close, guys. Need to talk about techniques for taking a sexual history. And again, you've got to feel comfortable, but you need to ask things. Now, if they start asking questions and you have no idea what they're talking about, you can always get someone else who is more versed on whatever they're talking about. But one of the things that I have given you, let me see if I can find it. Let me show you this. Okay, so what I have done in your OB book, okay, your OB Peds book, there's actually really on page 346, you need to go through and read this stuff. So it talks about techniques for taking sexual history, setting the stage, the things that you do, introducing the topic of sexual activity. And it gives you ideas and ways. You don't start with yes or no. You don't do yes or no questions. You start with a big general subject and pare it down, okay? And you treat it as a matter of fact. And again, if you're going to set the stage, you're not going to be putting them in. Let me come back to over here. You're not going to be putting them in a position where they're talking to you and telling you these intimate details at the nurse's desk and things like that. So the way that you're going to get tested on this, make sure you read through that, which is it's in the modules, or you can just go to that page 346 in your book and actually read it. It will give you some very good feedback on how that works. And then let's see, we've got some little things that I put in here. So the things that you need: sufficient knowledge, accepting another's beliefs. Okay, that doesn't mean that you condone them. Just because you accept them, that is their belief. Okay, doesn't mean that it is your belief, but you have to be able to help them in whatever. Aware of your own values and beliefs, comfortable talking about intimate concerns. So the tool used to ask questions is when you collect that sexual history. Most begin with the least sensitive area. You want to be confidential, reassuring atmosphere, and non-judgmental. So if we're setting the stage, in essence, of what's going on, you're going to create an environment conducive to sensitive issues. So you may go into a private room where you can talk to them, or you're in the room, or if there's 5 million people in the room with the person, make sure that, they feel comfortable with who's ever in the room. So if they don't want those people in the room to discuss these things, then you need to have the people step out. Be relaxed, treat it like any other medical subject, just like you were listening to their lungs or their bowel sounds or whatever. Private location, free from distractions. So maybe you want to turn the TV off. May want to conduct with the patient in their street clothes. They say that, but a lot of times it's really hard. If they don't, you're not going to put their street clothes on to start asking this stuff. But you may want to reiterate some of that stuff when you are discharging them or something like that. And try to make it just you and the patient. So how do you actually introduce that subject? Explain why you're taking the sexual history. Explain that this is routine, and you ask all patients. Reinforce the confidentiality, and integrate sexual history into the lifestyle component of your genital urinary. So you can be doing your thing and get to the genital urinary thing and go into doing a sexual history. Okay. Begin with an open-ended question, which encourages a more complete, not yes/no questions, okay? That is not the selection on the test, guys. Avoid leading questions. So you're not going to say something like, you don't masturbate, do you? And the way that you have inflections in your things indicating that maybe what they were doing was wrong or not wrong. I mean, that you are not the judge. You're just listening to their story and trying to give them some help in whatever they have. So be matter of fact, sensitive, and don't appear bored. Okay. One of the other things I will tell you that if you have a question about masturbation, that it is classified as a normal sexual activity, no matter what you've been taught. Okay. So for this test, it's normal. Be aware of your nonverbal communication. They should convey comfort and responsiveness. Introduce questions in a generalized statement, just like I said before, not all pared down, little things. Generalized, bring it in. Okay? Now, how are you going to respond to some of the answers that they may have? Okay. Do not act surprised, shocked, or embarrassed by the answers you get. And do not be judgmental. Okay, they're going to be a lot of times they're going to be very sensitive as to why you're asking and what you're doing. Okay, so let's look at different cultures when you're taking an actual sexual history. So consider that if a woman would feel more comfortable with a woman asking the questions and vice versa. Okay, for language barriers, consider an interpreter. Don't assume that nodding is a sign of understanding. I've seen that a lot, and they're and have no idea what you're saying. Lack of eye contact may be cultural, so be aware of what culture they are in. It doesn't mean that they're embarrassed and they don't want to talk to you. It may be something that's cultural where they are not supposed to be looking at you straight in the eye. Speak clearly, avoid jargon. Don't talk over or down to the patient. Okay, so try to be on the same level. So that's kind of an essence of what a sexual assessment would do. Okay, the last thing we have to go over, and I know you've probably done this someplace, but I can't find it anywhere else, and they've stuck it in this module, is sexual harassment in the workplace. So I'm going to show you a little video. There's some terms that I've given you that you need to be aware of, and let's see, this should not take that long. So first I'm going to get this. Okay, let's see if this works. I got to turn this. I am so sorry. Okay, so yeah, I was talking. So the whole thing is I had these two people that really hit it off, and they like to interact a lot. And they were always making interesting comments. Well, if you didn't want to be around it, that was fine. You could just leave, right? But the doctor, one of the parties that was kind of the harasser person, it was just blown out of the water that anybody would think he was sexually harassing them. And the whole thing is I said, it's your interactions, and the person at the desk can't leave. And so it was never intended to be a harassment to her, but he needed to calm down what he was saying. Same kind of a thing is there was one guy that I just he couldn't, every other word was the most foul thing I'd ever heard. And I did everything I could possibly do to avoid him. He was like a resident or something. And I just plain wouldn't even be in the room. He'd come in the room and I would leave because it was just so bad. So again, it's on the eye of the beholder, not the person giving it to them. Does that make sense? Okay, so, and the next things that I have on here, that goes through like sexual bantering, the kinds of things that they talked about in that little clip. And then what you do. A lot of times you have to realize that sometimes they don't realize what they're doing. They're saying, please, would you not do that? Now, if you don't feel comfortable and you're the getting all the garbage, yeah, by all means, you can go to the person above them and let them do that. But if you can, try to get them to stop whatever they're doing in the first place. And if that doesn't, then you go up the chain of command. So as ending here, honestly, dear, I really do have a headache. There's an arrow in there. So do you guys want to have a little 10, 15-minute break, and then she'll do the review? What do you want to do? This is where you get to tell me. Okay, now the only people who've responded to me is say, okay, I'm ready now. So if I do have to go, I do have to call Natasha and tell her that you're ready. Okay? So let me give her a little jingle. Don't forget your crossword puzzles. There's 2 of them for tomorrow morning. Hi, they're ready anytime.
Oh, okay. Thank you.
Okay, we'll take you a little. You're going to download something? Okay, sounds fine. Then I will end this one, and then we'll go from there. And you'll invite him out for the review. Okay, we'll do. Thank you. Bye. Okay, guys, so she's going to invite you and go from there, and I'm going to end this right now. So if you have any questions about what we talked about, feel free to send me off a text or whatever, and we will go from there. So have a fun day.